So what if something other than the blood vessel is adding extra fluid to that interstitial space? Here you want to think about a ruptured Baker's cyst, which can cause interstitial edema. Next, remember that your body needs a secondary drainage pipe other than the blood vessels to get fluid out of the leg. But what if that pipe isn't working? The lymphatics can become obstructed, leading to ineffective drainage from the leg and edema. One cause of lymphatic obstruction is cancer. This can either be located within the lymphatic system or outside and pressing on it. Also think about trauma and surgery, which can damage or just remove the lymphatic system altogether. This can be intentional, like in a lymph node dissection, or it can be a consequence of another surgery. Either way, the result is less drainage and edema. So let's go back to the main two forces at play in the leg: hydrostatic and oncotic pressure. Your body is counting on hydrostatic pressure being low at the end of the capillary, so that oncotic pressure can bring fluid back in. But what if hydrostatic pressure stays high instead? That means less fluid going back into the leg and more edema. So let's look at some causes of increased hydrostatic pressure. If the mechanisms that are supposed to bring fluid out of the leg aren't working, fluid's going to stagnate and hydrostatic pressure will rise. There's two big examples to think of here. The first is inactivity. Remember that muscles of the leg squeeze the blood vessel to bring it back to the heart. If those muscles aren't squeezing, blood's not moving as much. The second is venous insufficiency. If those one-way valves in the leg aren't closing correctly, blood's going to be able to flow right back down to the leg and increase hydrostatic pressure. There's one more thing I want you to think about here, and that's gravity. Your body is always going to have a harder time getting fluid back to the heart if it also has to fight gravity. So if there's some process causing too much fluid to build up in the leg, that process is going to tend to get worse after a long day or after sitting or standing for a long period of time when gravity's been working in the leg.